So now we're going to start discussion about the foregut development. See, I told you already in the foregut, one diverticulum will develop, and that is our respiratory diverticulum. Okay. Now, apart from the respiratory diverticulum, in the foregut tube, yes, we also have liver bed and few more buds, the pancreatic bed, ventral and the dorsal pancreatic bed. So, in the foregut development, we're going to discuss the development of stomach, development of duodenum, development of liver, and development of pancreas. So these four organs we see. Now first we're going to see the development of stomach. Okay. For stomach development, so first we have to know some basic points about the rotation of the stomach. Stomach will rotate. Okay. So we know about the midgut rotation. Midgut rotates 3 times 90 degree in the counterclockwise direction. The stomach also rotates. Stomach rotates 2 times, each time 90 degree in the clockwise direction. So stomach rotates each time 90 degree in the clockwise direction. Okay. Now the rotations takes place in 2 axes. One in the vertical axis, another one in the anteroposterior axis. So rotation in 2 axes. First rotation in the vertical axis. In the vertical axis, the first rotation takes place. Now stomach tube will be like this. This is stomach tube, say. Now this is anterior and this is posterior. Now the first rotation takes place in the vertical axis. In this axis, the rotation will take place. Okay. Now because of that rotation in the vertical axis, the anterior border becomes right border, and the posterior border becomes left border. Now because of rotation in the vertical axis, the anterior border, now after the rotation, it becomes the right border. The posterior border, my thumb, becomes left border. Because of rotation in the vertical axis, the anterior border, it becomes the right border, and the posterior border becomes left border. Is that clear? Next, the second rotation in the anteroposterior axis. Second rotation in the anteroposterior axis. Okay. So in this axis, rotation takes place. Now this is upper end and this is the lower end. Okay. The stomach tube is like this. Now the second rotation in the anteroposterior axis. Now because of that, yes, the upper end goes to left side and the lower end of the stomach comes to right side. The tube is like this and the rotation is like this. Okay, the clockwise direction. So now because of the rotation in the anteroposterior axis, the upper end goes to left side, the cardiac end left side, and the pyloric end on the right side. Okay. So because of second rotation in the anteroposterior axis, now this upper end goes to left side and the lower end goes to right side. Okay, right. Next, this is a basic idea about the stomach, how stomach got the right border, left border. Now why the upper end is on the left side, why the lower end is on the right side? This because of rotation only. Now after this, we're going to discuss about the mesentery in the stomach. Okay, stomach is a peritoneal fold having the mesentery in the front side and back side. Now this is stomach tube. Okay, now this is a stomach tube. Now this is front side, anterior, and this is back side, posterior. Anterior and posterior. Now the stomach is connected to the front side, anterior side, by ventral mesogastrium. Now this is our ventral mesogastrium. So this is anterior abdominal wall. So now this is our ventral mesogastrium. Ventral mesogastrium. It is connecting the stomach to the anterior abdominal wall. Okay. Now similarly on the back side we have posterior abdominal wall. So here back side, yes, we have posterior abdominal wall. Now stomach is connected to posterior abdominal wall by dorsal mesogastrium. Now this is dorsal mesogastrium. So this is our dorsal mesogastrium. So this is dorsal mesogastrium. So dorsal mesogastrium connects the stomach to the posterior abdominal wall. Now this is stomach tube. Okay, right. So now we have peritoneal fold in the front side and back side, connecting the stomach to the anterior abdominal wall and the posterior abdominal wall. Now in the ventral mesogastrium, liver is formed. The ventral mesogastrium, liver is formed. So liver is formed in the ventral mesogastrium. Okay. Now we have the peritoneal fold from the stomach to the liver. The ventral mesogastrium from stomach to liver. It is forming lesser omentum. I am writing lesser omentum here. So this part will form the lesser omentum. So lesser omentum derived from ventral mesogastrium. That is a ventral mesogastrium present between the stomach and the liver. Now from liver to anterior abdominal wall. Now this one, and that will form the falciform ligament. Very good. That will form the falciform ligament. So from liver to anterior abdominal wall, I am saying falciform ligament. So falciform ligament derived from, again, ventral mesogastrium. Now the falciform ligament, which in turn gives two more ligament, coronary ligament and triangular ligament. Okay, so ventral mesogastrium forms four structures. Mnemonic is lesser fact. So lesser means lesser omentum. FA means falciform ligament. CT means coronary ligament and a triangular ligament. So these ligaments are coming from ventral mesogastrium, mnemonic lesser fact. Now, what about dorsal mesogastrium, sir? Now the dorsal mesogastrium, spleen is formed. So spleen is formed in the dorsal mesogastrium. Now we have peritoneal fold from stomach to spleen. Now that is our gastrosplenic ligament. Now from spleen to posterior abdominal wall. Spleen to posterior abdominal wall. Yes, the posterior abdominal wall, left kidney is present. So now here, lieno-renal ligament. Okay, from kidney to spleen, left kidney to spleen. Lieno-renal ligament, spleno-renal ligament. Now the remaining part of the dorsal mesogastrium will form the greater omentum. So we'll write all this. So write an abbreviation here. So dorsal mesogastrium forms gastrosplenic ligament. Number 2, lieno-renal ligament. And number 3, greater omentum. Okay, yes. Derivatives of dorsal mesogastrium. Fine. Over. Now we're going to take the cut section. Now if you take the cut section, now how the diagram look like. So now we have taken the section in this plane. So in the cut section, we take the cut section in this plane, how the diagram. Okay. Now we see here. Now this is the stomach. Okay. And we have peritoneal fold, I told you. Now this is the front side and back side. So now this is the cut section. So this is our ventral mesogastrium and mesogastrium, and this is our dorsal mesogastrium. Now this is front side, anterior, and this is back side. I told you in the ventral mesogastrium an organ is formed. Which organ? Your liver. So liver is formed in the ventral mesogastrium. That is our liver. Similarly, in the dorsal mesogastrium, spleen is formed. Yes. So now I told you stomach will rotate. Now because of that, the rotation of stomach in the clockwise direction, the liver will come to right side and the spleen will go to left side. See, imagine my right hand is the liver, my left hand is the spleen. So right hand, liver in the front side, spleen on the back side. Okay. Now rotation in the clockwise direction like this. So rotation in the clockwise direction like the stomach. Now because of that, liver come to right side, spleen go to left side. So now we're going to draw one diagram for that. So now because of this rotation, yes, liver will come to right side and spleen go to left side. Now we draw one diagram for that. So now this is the cut another diagram. Now this is our liver, okay, and this is our stomach, and this is our spleen, okay. Now this is the peritoneal fold from the posterior abdominal wall to spleen, from spleen to stomach, from stomach to liver, like this. And this is the again from spleen to kidney, from stomach to spleen, and it is coming here like this. So now, yes. Now because of the rotation, now we got one new space. That space is formed, yes, behind the stomach. That space is called lesser sac. Now this is liver. Now this is lesser omentum. This is stomach. This is spleen. And this is our gastrosplenic ligament. And this is renal ligament. So now I told you because of rotation of stomach, I told you liver come to right side, spleen go to left side. Now after that, one space is formed behind the stomach, and that space is called lesser sac. So now we got lesser sac. Now we also have one space, big space in the front side, that is called greater sac. Okay, so now we got lesser sac. So lesser sac, please write, it is the small space, it is the small space which is formed behind the stomach. Why? Due to rotation of the stomach. Due to rotation of stomach in the clockwise direction. In the clockwise direction. Okay. See, now we are seeing only the formation of lesser sac. Lesser sac, the space is formed behind the stomach due to rotation of stomach in the clockwise direction. Okay. This is a formation. That's all. The boundaries of lesser sac, what is the front side, back side, above, below, reflections, and what is the communication of the greater sac, everything discussed in the peritoneum topic. Okay, so don't worry. So now we are bothering only about the formation. So lesser sac, the space is formed behind the stomach to rotation in the clockwise direction. Clear? Right. That's all about lesser sac formation. And by this, yes, we are finishing the development of stomach. So we have completed, yes, the development of stomach. Now we're going to see the development of duodenum. Okay. So duodenum is coming from both foregut tube and the midgut tube. Duodenum up to the second part, the opening of ampulla of Vater. The opening of ampulla of Vater, up to the opening of ampulla of Vater, it is coming from foregut tube. Okay. Now from the second part, yes, below that, below the opening of ampulla of Vater, the remaining part of the second part, the third part, and the fourth part, they are coming from midgut tube. The remaining part of duodenum, the remaining part of duodenum is coming from midgut. So up to the opening of ampulla of Vater, it is a foregut derivative. Now below the opening of ampulla of Vater, it is coming from, yes, midgut. So duodenum is organ which is coming from both foregut and midgut. That is the point. One time they gave this question in the DNB exam. So duodenum is supplied by, now what is the artery of foregut? We know already, celiac artery. So celiac artery, the celiac trunk, yes, supply the duodenum. And duodenum is also supplied by superior mesenteric artery. So duodenum derived from both foregut tube and midgut tube. So duodenum is supplied by celiac artery and the superior mesenteric artery. Clear? Fine. Now, next one. Now we're going to discuss about the peritoneal fold for the duodenum. Actually, because of rotation of stomach, the duodenum tube comes to right side and becomes a C-shaped loop. Now, due to the rotation of stomach, duodenum becomes C-shape and it comes to right side. Now, this is the duodenum say. Okay. Now, initially, duodenum is having the peritoneal fold. Now, this is the posterior abdominal wall. Initially, duodenum is having the peritoneal fold. The peritoneal fold is called mesoduodenum. Initially, I'm saying, the very early stages of development, yes, the duodenum is having peritoneal fold, and that fold is called mesoduodenum. But later, mesoduodenum disappears. Later, mesoduodenum disappears, and the duodenum becomes retroperitoneal organ. So, duodenum becomes retroperitoneal organ. So, later, yes, this part, the mesoduodenum will disappear, and the duodenum attached directly to the posterior abdominal wall. So, duodenum is not having the peritoneal fold. The mesoduodenum disappears. Okay, that's all. Now, next, we're going to see the development of liver. That's all about duodenum development. Very few topics. Duodenum is coming from both foregut and midgut, so supplied by celiac artery and superior mesenteric artery, and duodenum is not having the peritoneal fold. Okay, right. Only proximal part, 2.5 centimeter of the duodenum is having the peritoneal fold that we discussed in the gross anatomy of duodenum. Okay, so you leave that. Now, next, development of liver. Now, liver is coming from two sources. What are those? Number one, liver bud, and number two, septum transversum. So, the hepatic bud or liver bud, again a diverticulum from the foregut tube. Okay, now this hepatic bud forms the parenchyma of the liver. It will form the tissue of the liver, parenchyma of the liver, and the entire biliary system. The entire biliary system and the parenchyma of the liver coming from the hepatic bud. Okay, right. Next, the septum transversum. The septum transversum is a mesodermal structure, yes, and that forms the connective tissue of the liver. That forms the connective tissue of the liver. It forms the capsule of the liver. It also forms the sinusoids of the liver. It also forms the Kupffer cells of the liver. So, all these are coming from the septum transversum. Septum transversum is a mesodermal structure. Septum transversum is the mesodermal structure. Okay, right. That's all about the liver development. Very simple. Liver is coming from two sources, hepatic bud and septum transversum. Right. So, hepatic bud is forming the parenchyma of the liver and the biliary system, and the septum transversum, the mesodermal structure, forming the connective tissue, capsule, the sinusoids, Kupffer cells. They're all coming from the septum transversum only. Okay. Yes. That's all about liver development. Next, pancreas, development of pancreas. Now, see here. Now, pancreas is coming from the pancreatic bud. We have two buds, ventral bud and the dorsal bud. Now, see the diagram? Yes. The diagram, yes, this is a foregut tube. Yes. Now, in the foregut tube, now we have the ventral pancreatic bud and the dorsal pancreatic bud. Okay. Now, I told you, due to rotation of stomach in the clockwise direction, see the duodenum. The duodenum is coming to right side and it becomes C shape. So, duodenum is rotating along with the stomach and it comes to right side and become C shape. Okay. Now, because of that, the ventral bud rotate and lie below the dorsal bud. See the direction here? The ventral bud is rotating and it lies below the dorsal bud. So, please write. Again, same thing we are writing. Due to rotation of stomach, duodenum becomes C shape and comes to right side. Duodenum becomes C shape and comes to right side. Now, because of that, the ventral bud rotate and lie below the dorsal bud. And lie below the dorsal bud. Okay, fine. Now, see the diagram. Now, the ventral bud now rotated and lying below the dorsal bud. Now, the entire pancreas is coming from dorsal pancreatic bud only, except a very small part of the head and the uncinate process. Now, these two are coming from the ventral bud. The remaining bulk of the pancreas is coming from dorsal pancreatic bud only. So, please write. The dorsal bud forms the entire pancreas. Dorsal pancreatic bud forms the entire pancreas, except the lower part of the head and uncinate process. Now, these two are coming from ventral pancreatic bud. So ventral pancreatic bud forms the lower part of the head of pancreas and the unciliate process. Remaining everything, it is coming from dorsal bud only. Okay, fine. So development of pancreas over. Next, duct system. Now dorsal bud is having the dorsal duct and the ventral bud is having the ventral duct. Okay, fine. Now we have major duct and the minor duct. Now the major duct is coming from, see here, I'm going to shade this area. Now the major duct is coming from, this entire thing is a dorsal duct and this is our ventral duct. Okay, right. Now who is forming the main pancreatic duct? The main pancreatic duct is coming from this one. The main pancreatic duct is coming from this one and this one. Now this is A and this is B. That is the main pancreatic duct. So main pancreatic duct is coming from the distal part of dorsal bud. Yes, this is the distal part of dorsal bud, A. And what is B? The whole of ventral duct. So main pancreatic duct, please write. The main pancreatic duct is coming from A, that is the distal part of dorsal duct, plus B. B is the ventral duct. Okay, so they join from the main pancreatic duct. Now what is left now? Only the proximal part, this part. The proximal part of the dorsal duct is left and that will form the accessory duct. Accessory duct. So the accessory duct, okay, accessory pancreatic duct, it is derived from the proximal part of dorsal duct. The proximal part of dorsal duct. Okay, right. So that is about the duct system development. Okay, so we have major pancreatic duct and the minor duct. The major duct is coming from the distal part of dorsal bud, distal part of dorsal duct and the ventral duct. They join and they form the main pancreatic duct. Minor pancreatic duct or accessory pancreatic duct is coming from the proximal part of dorsal duct. Okay. Now by this, yes, we are completing the development of pancreas. So now we're going to see some anomalies. Okay, so anomalies, yes. Now the most common anomaly in the development of pancreas is this one only, pancreatic divisum. So pancreatic divisum, it is the most common anomaly. Most common anomaly in the development of pancreas. In the development of pancreas. Pancreatic divisum. Name itself you have a clue. Pancreas is divided. So the ventral bud and the dorsal bud, they remain separated and the duct system remains separated, dorsal duct and the ventral duct. Okay, so only one thing, pancreas is divided, pancreatic divisum. Okay, that is the most common anomaly you see in the development of pancreas. Next, annular pancreas. See, annular pancreas means, annular means a ring. There's a ring of pancreatic tissue around the duodenum. Why, sir? Because of the bilobed ventral bud. I told you we have only one ventral pancreatic bud. But this condition, annular pancreas, is due to bilobed ventral bud. Bilobed ventral bud. Bilobed ventral bud. So we have two ventral bud. Two lobes are there for the ventral bud. One bud rotated in the front side, another bud rotated in the back side, and they form one ring around the duodenum. So, and they form one ring around the duodenum. See, one bud is rotating in the front side, another bud rotating in the back side. So they form one ring of tissue around the duodenum. One ring of pancreatic tissue is formed around the duodenum. That is called annular pancreas. Okay. So annular pancreas is due to bilobed ventral bud. Now, these are two anomalies that you have to know in the development of pancreas. And by this, yes, we are completing the development of foregut.